Hey, 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 Liv from livebygrace.com. I wanted to come on today and talk about endometriosis because March is Endometriosis Awareness Month and your girl has it. Okay, unfortunate. But thankfully, the Lord is healing me of that. It's a process, and I'm thankful that He's been with me every step of the way. So, it's a disease that's kind of under the radar, I think, and even a lot of doctors don't really know about it or realize how common it is. But quick statistic, it's like 1 in every 10 women at least has endometriosis. I think just personally, I'm guessing there are a lot more out there who have yet to be diagnosed because these are obviously the numbers that we know of. So it takes women on average something like 7 to 10 years to actually get their diagnosis, which is really sad. And I'm going to just share my story today. It's just like I did not practice this or anything. It's just all coming out. So beware. So my story starts like from the time I got my period, pretty much. I had the worst period ever. Okay, so let me just back up for a second because, yeah, I'm talking about periods today. That is what endometriosis is about. Women-only disease. So if that freaks you out, feel free to ignore this video, but I think it would be beneficial for everybody to hear a little bit about it because we do need the awareness out there. I did want to give a heads up, like, yeah, this is a sensitive topic to some people, so endometriosis, if you don't know what it is kind of misunderstood, I think, even in the medical community still. A lot of people think and say that it is the endometrium is the lining of the uterus that's shed every month. That's how women have their periods, okay? So endometrial tissue that travels from inside the uterus to outside the uterus to other places of the body that's obviously not supposed to be. That's the common understanding of endometriosis. Although I have read recently that the tissue from endometrial implants that's found in other places outside the uterus, on other organs or on abdominal walls, can travel really far throughout the body also, but those are more common places. That these tissues are actually not the same as the lining of the uterus. They are slightly different. I've also heard that you're born with it, that those tissues are already in strange places in your body, and it's just really not activated, and that scar tissue doesn't really grow until you start to have your period, and then that scar tissue continues to build. So it's kind of like a misunderstood, not fully understood thing, even by the medical community. There's talk that it's possibly an immune disease, like an immune disorder type of thing. We don't really know. There are a lot of women who have endometriosis that have a lot of like autoimmune kind of symptoms. So to me, it wouldn't be surprising. So what happens is the endometrium, or a similar like tissue, when it sheds every month when you have your period, those pieces of tissue can like travel inside the body. There have been women who have had implants of this tissue on their lungs, in their brain, their heart, the liver, all kinds of organs. My experience has mostly just been abdominal area, and I'm thankful for that, but it's kind of scary when you stop and think about it. My personal journey was just that, okay, this is something that's annoying, irritating, painful, causes me these symptoms, and I just have to deal with it. Like, it's just there and it's irritating. And then recently, when I had my latest surgery, I started researching about personal experiences that women have that they've been sharing online. And there are women out there who have had to have part of their lung removed because they had scar tissue that was so bad that it destroyed part of their healthy lung, and they had to have that removed. Women who have had kidneys removed because of this. So it's a really invasive disease. It just varies from person to person how your body reacts to it, where it pops up in the body, and how severe it can get. Traditionally, I think it's been viewed as more of a issue with infertility because that's a huge symptom. And a lot of women seem to be diagnosed only when they try to become pregnant and have these issues. And that's when the diagnosis of endometriosis comes up. So it kind of has this this like label attached to it that has to do with infertility, and that's definitely a big part of it. But it's more than that. It's more than an annoyance. It's more than an infertility issue. It is a danger to overall health, and I'm starting to realize that myself. With the latest experience I had, praise God, I have not had the kind of invasive stuff that some women have gone through. Some women have horrible pain day in, day out. I'm so thankful that the Lord is healing me of this and that He's prevented me from some of the worser things. Anyway, so now that I've shared a little bit about that, I'll start with my story again. Okay, so my experience with endometriosis, looking back now, I know that it started as soon as I started my period, like 13, 14, however old I was. First period was incredibly painful. I know that's common for lots of girls. But as the years went on, it was bad. Very, very painful, and the symptoms just got worse. I had other symptoms at the same time. Every month when I was on my period, I would have diarrhea. There's cramping. I'm going to say the great majority of women have cramping. I read somewhere once that there's like a small percentage of women that have no cramps when they have their period, and I'm just like, that's completely foreign to me. Yay for them. Most of us experience the cramping, am I right? So mine got so much worse. It was like debilitating. There were days when I missed school. And as I got older, it just increased. And the symptoms became more intense and more frequent. So I remember when I was like in my early 20s, I would have this horrible pain on my left side. And it started just being, the same time that I would have my period or right before ovulation, there would be this horrible pain. But then it started happening randomly. Not related to ovulation, not related to PMS or my actual period or anything like that. And it was just, it really interfered with my life and my quality of life. And I would just double over sometimes, or I would get this look on my face. And my mom would ask me what's wrong, and she knew that I had all these symptoms, so I just kind of named it my spleen. I'd be like, my spleen, it's my spleen. It was kind of like a code word to not have to talk about periods and cramps and all that kind of stuff, like in front of male relatives or like out in public at places, just like, it's just my spleen. And my mom and my sister were like, yeah, okay, we know what that means. So it was like, even when I was a teenager, it was really bad. I remember I was like 17 or 18, I think, was my first experience. And looking back now, I honestly think I may have had like an ovarian cyst rupture. And because it was like this intense pain. It, at that time, had been the worst pain I'd ever felt in my life. And I just remember rolling on my bed, and I rolled off my bed. And my mom was pretty concerned. And I think I may have had a slight fever at the time, which is something that I've had ever since. And it just became more and more frequent the older I got. And it would be like off and on fevers for seemingly no reason. Anyway, so she was pretty concerned, and she called like an emergency number or what have you. They told her it could be appendicitis, so they needed me to come in. And at that time I was still a teenager, so they sent me to the children's emergency. And I have like no memory of being there. I don't know if I was just out of it because I was in so much pain or what, but I do remember just a smidgen of it. There's like once couple seconds I remember in there where they just had me sitting on this exam table, and this woman doctor came in, and she told me, I don't even remember. Like, I don't remember if they ran tests or scans or what they did. But she came in and she said that they didn't find anything wrong with me, and I needed to see a gynecologist. So I went to the gynecologist. I can't remember exactly. I think I was a teenager. I might have been 20-ish. So I made an appointment, went to the gynecologist. I made a list of my symptoms because I was like, okay, I'm going to get this addressed, So I wrote down all these things like fever off and on, where the pain was located, what kind of pain it was, and like the fact that it was obviously super worse during my period, but that it would just happen randomly too. And so I made a note of all these things and all my symptoms, and I had urinary symptoms, I had bowel symptoms. It was like when I was on my period, I would have to go number 2, and there's no holding it. And it was so painful. And it would be like diarrhea type stuff and awful. And then I started developing urinary symptoms. I'd have to go to the bathroom all the time and couldn't hold it for very long either. It was like my bladder would be full each time I go to the bathroom. And it would be like, and it was so weird. It was like when I would eat lunch And when I was at work, I would go to the bathroom at my lunchtime, then I'd sit down to eat lunch and go to the bathroom again after I was done eating and go back to work. And then it would be like 20 minutes, right about 20 minutes every single day after I would eat. I would have to go to the bathroom so bad. And I knew this was the thing, so I kept myself from drinking much at all with my lunch when I ate. Drink like just the tiniest sips of water to try to avoid this, but it never helped. And it'd be like 20 minutes like clockwork every single day. My bladder would be so full. It wasn't just the sensation I needed to go, I had to go. So I would go to the bathroom, come back, again, right about 20 minutes. I'd have to go again, same thing. It was always after I would eat. So strange. And having to go during the night, I would wake up. It got to where it was half a dozen times every night. It would sometimes be a dozen. And it was just wearing me down. It was making me sick as I got older. Like just trying to go to work during my period, it was awful. And sometimes I wouldn't be able to go in. I'd be too sick. And there were times where I'd wake up in the middle of the night throwing up and like I would have no fever. It was like, it wasn't a virus. I wasn't actually sick. It was just something was wrong. And that first gynecologist that I saw, she was very well respected in our town. Seen lots and lots of patients, very experienced, been practicing for many, many years, and I listed off my symptoms to her. She gave me a condescending smile. I don't know if she disbelieved me because I was so young, or maybe she thought I was like a hypochondriac because I had this list, but I told her, like I made a point, I really want to address this. I've written the things down as I thought of them so I wouldn't forget anything when I was talking to you today. So I don't think I came across that way, but she had a very condescending attitude toward me. Told me that none of those symptoms could be caused by any sort of female issue, and I needed to go back to a general practitioner. And then before I left, she handed me a handful of like a dozen pamphlets, and I'm like, why are you handing me these if you're telling me there's nothing wrong with me, kind of logically? But I just leafed through each one, and I got to the end of the list, and there at the end of the stack of these pamphlets, and at the end one said endometriosis on it. I opened it up, I started reading it. It listed every symptom I had. And I flipped it over to the back, and it was like 10, 12 years old. And I thought, this woman, she would read her own pamphlet. This thing can tell me what's wrong with me, and this woman's acting like I'm crazy. So the only thing that she did do for me is she diagnosed me with painful periods with dysmenorrhea, and gave me a prescription for continuous birth control, sent me on my way. Now I forget, it was before I saw her, actually. When I was younger, the very first time I saw a gynecologist, they told me the same thing, painful periods, and they put me on the birth control pill. And so I began to take that, and I took the first dose, and I was sick as a dog, just throwing up. It was so miserable. And I was like, I'm not taking that pill again. No, like I'm sick enough. I'm not going to be throwing up all day. Like, no. And I don't know, that may have passed if I would have stuck with it, but it was just too miserable to even imagine. And my mom thought, well, you just have some virus. It just happened at the same time. You need to take the next pill tomorrow to get it going, whatever. So it was like, I'm not taking that thing again. So I waited a day, and I thought, okay, try again. Just as sick. So I was done with that. And so yeah, that was my first experience. And then the next time I had gone to the gynecologist for some help. And she told me, none of that had to do anything with female issues. She did, again, diagnose with dysmenorrhea, painful periods of some underlying cause of which she thought she didn't know, or that endometriosis could not cause. But she put me on continuous birth control. And I chose the patch because that was available then, and I had such a good experience with that. That's what I still use. And she put me on continuous birth control, so that helped so much. But still, the root of the problem was there, and it was to the point where it wasn't just on my periods. The symptoms were worse, and the periods were extremely painful. So having the patch on continuously, I didn't have any periods. So that aspect was improved so much, but I still had a lot of other symptoms, like the urinary thing, the bowel thing, being fatigued all the time. That was so depressing. Like, the first couple of years that I was married, it was like I couldn't do anything. I would go to work in the morning, I would come home in the evening, and it was like I couldn't even go to the grocery store. I learned pretty quick. I can't go out to the movies. I can't go out to do something fun. I can't even go, like my husband and I, to go visit our family in the evening. It was like that was something I had to do on the weekend. I just had no energy. And if I would try to like live a normal life, even just sit home and do the dishes or pay the bills or whatever in the evening, this like small things like that would wear me out physically. And it would make me sick the next day, and I'd end up missing work. And so I started to notice this pattern, like, I can't do anything. I can't do anything, or I'm ill. And it was so depressing. So I started realizing, like, I don't have a life. Like, I felt like all I was doing was working, and that's what it was. And I had to either choose, live my life and be sick the next day and not be able to go to work. And, we needed my job. So we needed that income, and so I didn't have a choice. And then it was even interfering with us being able to go to church. And it's like on the weekend, I would have to use my Saturday to like recover from the previous week, try to rest and get some energy back. And then on Sunday, it was like if I would go to church, I would be sick the next day. I don't know. It's just like my body was on overload, and I was so ill, and I had all these things happening inside with the disease that I didn't know because I still hadn't been diagnosed. So it was like I couldn't do anything. I was getting really depressed because I couldn't do anything. And then, people like friends, it's like I couldn't even go out with any of my friends. And anytime it was like I had to have this excuse, and I would even say like, oh, I have to do this instead. It got to the point where it was like I was using my health way too much, and people were starting to think I was weird, or maybe that I was making it up, or it was all in my head. I don't know. I started to even question myself. And even my family, then it was like they thought I just didn't want to be around, or I don't know what they thought. Maybe they thought I was making it up too. I don't know. I know my mom for sure believed me. My sister for sure believed me. They'd seen me live this out, so they knew it was a real thing. They knew something was wrong with me. So, and of course my husband, after we were married, he saw this the first couple of years we were married, and it was just like, it was very hard. And then my mom said one day, you need to go to my gynecologist. You probably have this endometriosis. And I had wondered that too from the information that one doctor had given me. So my mom was like, my doctor's taking new patients right now. You need to go see her. She will listen to you. This woman was amazing. She was literally a godsend. I'm so thankful for her. My voice is kind of giving out. I apologize. So I went to see her, and she listened to me. She took notes when I explained my symptoms to her. And she said, okay, you know what? We need to do an ultrasound. Can you do it right now? And I was shocked. I thought for sure, okay. I was like, okay, an ultrasound, nice. Like, we're going to try to figure this out, And then she wanted to do it right then. I was so surprised. I was like, well, yeah, let's do it. And come to find out, my symptoms could have been caused by some sort of either cervical or ovarian cancer. So it was like the symptoms I was presenting could have been that, or it could be endometriosis. This doctor recognized that. So previous doctors I had seen, it's like, it could have been something way more serious, And they just didn't care. They didn't care to treat me or to look into it. So I was so thankful to find this doctor. She did this ultrasound and saw that, there were a couple of issues she could see, but she was able to rule out the cancer with the ultrasound. So thankful for that. And to be honest, I wasn't worried about that. But she said, I'm suspicious that it could be endometriosis, but the only way to truly diagnose is to go in and do diagnostic surgery. So I was like, well, I'm tired of living like this, so let's do it. And she went and she did the surgery, and afterward, I didn't realize that there were a couple of different types of surgery for endometriosis. There's what they call ablation and excision. Ablation is when they go in and they find these implants of the tissue wherever they may be, in the uterus, in the bladder, the bowel, the abdominal wall, wherever they're located, and they zap them with a laser. So it removes that tissue, but it doesn't get at the root of the tissue. So it's sort of understood that this will grow back, and it's just sort of up to your body as to how long you'll get relief with the surgery. It could be 2 months, it could be 2 years, it could be longer, it could be shorter. Everybody's different. So I was like, well, let's try it and see if I can get some relief. It's worth it, even if it's just, a year or whatever. So we did that, and she found that my uterus had actually adhered, like it's just supposed to be kind of in there, right? And it had adhered to my abdominal wall. So she severed that adhesion so it would be free again. And then one of my ovaries, same thing, was stuck to the side of my uterus, and that's not supposed to be there. That's supposed to be floating free. So she fixed that. And then I had adhesions on my bladder, which makes sense because of all of the urinary issues that I had. So she ablated those tissue implants, and immediately after surgery, I had relief. I was so thankful. This doctor went above and beyond too, because I had an umbilical hernia, which is like right around the belly button. And she coordinated with another surgeon for him to come in and repair that while I was under surgery for endometriosis. So I didn't have to have 2 separate surgeries. So that saved me a lot on medical bills, and it saved me a lot on recovery and having to go through that experience twice. And she even had him come in and perform that hernia repair. And then he left, and she closed the hernia repair so that she would be the only doctor I'd have to see post-op. Amazing woman. I'm so thankful for her. She's gone on to emergency gynecology now, so I don't get to see her anymore, but she was the doctor for me at the time when I needed her, and I'm so thankful for her. And my recovery was, the hernia was the hardest part, honestly. I had to stay in the hospital overnight. It was supposed to be outpatient, but I don't even know how long the surgery lasted. She said she was in there for longer than she thought she would be, and there was more in there than she realized going on. So she took care of everything, and just to make sure, like I was so out of it, and there was no way, especially with the hernia repair, that I could get up on my own, move about on my own. Nurses, let me just shout out to all the nurses out there. Bless you, because the work you do is absolutely needed and absolutely not appreciated as it should be. And I just remember thanking my nurse. I mean, you're like helpless. She helped me get to the bathroom. She had to help me clean myself. And it was just, I couldn't have done it myself. So I was so thankful. And my recovery was the worst with the hernia part of it. So like the endometriosis part, they make a small incision in the belly button, and then usually an incision on each side lower down of your pelvic area. And that's where they go in with the instruments, and they can go in with the scope through your belly button and do everything through these small incisions, which is awesome. So recovery is a lot easier in that way. So I don't even remember. I had some cramping, I think, and I had quite a bit of bleeding after that. Oh, and she did have to go in and do, because like the endometrium, that lining, that is the whole issue, that it travels out and everything. So the lining of the uterus was all like tatty and nasty and raggedy. She had to go in with a DNC and just like scrape all of that out. So I did have a lot of bleeding afterward and cramping. But more than anything, I mean, the hernia repair was like that big on my stomach, so I felt that a lot. And the endometriosis surgery was like so minimal. And the pain that I had from that, it was comparable to what I would go through monthly. So, and immediately I had relief. It was still like a process of healing, but immediately I wasn't having to go to the bathroom 10 times a night. I was going like 2-3 times. And then as I started to heal more, it's like I would only have to go like once or twice a night. And that was a miracle to me. And once in a while there'd be a night where I could sleep all through the night, and it was wonderful. So I started slowly to have a little bit more energy, but a lot of the bowel symptoms were still there. Bladder symptoms started to come back within a couple years, and still really fatigued. And then I had realized, oh, wait, there's 2 different types of endometriosis surgery. I had gotten the ablation, which is the most common, because excision is a more detailed surgery, and there aren't, from my understanding, very many surgeons out there who are trained in it. So they're very hard to find. And excision is different because instead of just lasering off, burning off the top of the affected diseased tissue, the scar tissue, and that endometrial tissue, instead of burning off the top of those implants, with excision, they cut it out by the root. So there's no root, there's nothing to grow back. So that's the gold standard for endometriosis surgery. And this is February 2019, so back in October, I started having this pain. Like all of a sudden I had this, and that was the thing too, I would have lots of urinary tract infections, and I'd have to go on antibiotics a lot. And then I'd get yeast infections a lot, and it was just like, I had so many every year. And they even sent me to a specialist, the urologist. They did a cystoscope, or whatever you call it, where they go up in through the urethra and look and check everything. He didn't find anything wrong with me. Obviously, everything was functioning properly. It was endometriosis that was causing the problem on my bladder. But he wrote me a standing prescription for a low-dose antibiotic to take because I had so many of those infections. And then it got to the point where it would be symptoms of infections, but there would be no, like, every test would show negative. But then when it would still get worse. Finally, it would show up in a culture or something. So I had so many of those experiences going on, which was really horrible. And then in October, I had that again. Like, oh, okay, I know I have a UTI. It was bad. It had the little burning sensation, the little frequency sensation, like a couple days, and it got better. I was like, okay, whatever this is, like, it's just going away. It's healing itself. Great. Then it came back with a vengeance. So I went to the doctor. I had a fever. They did a quick test and nothing showed up, but because I had a fever and I had pain in my kidney area also, and all the other symptoms, they treated it. And the urinary symptoms were gone after I finished my course of antibiotics. Like, I didn't have that burning, that urgency. That part was gone, but I still had pain in the kidney area. I started having other pain in my stomach, in the middle of my stomach. And it would move to the right side. It would move to the left side until it was just all over and like a sharp stabbing feeling. And so I started reaching out on social media, like, what is going on? Asking for help. And people are saying, that could be appendicitis. You need to go to the ER. So I remembered when my mom was very ill, when she had cancer, right before we knew it was cancer. I remember I took her to the urgent care, and this particular urgent care had imaging there. And so I chose to go to that urgent care. And of course, it was too late in the evening for them to run the CAT scan machine for whatever reason. But due to my symptoms, they said it could be appendicitis. You need to go to the ER. So I spent 10, 12 hours in the ER overnight with my poor husband, waiting patiently for me to be seen. They did a CAT scan. The doctor, I'd already seen the doctor in his office trying to figure out what was going on, and he'd done an x-ray, and they didn't see any kidney stones or any gallstones or anything like that. Everything looked fine on the x-ray. And so now I was having the CT scan, and everything looked fine. And I'm like, I know this is not in my head. I know it's not in my head. But it makes you question yourself, you know? And so they gave me something for nausea because I was nauseated also. And by that time, I'd been in the ER all night, so I was like, can I just get some fluid? Because I get dehydrated really easily. If you've heard my anorexia story, you know all about that. It's like, kind of ties in with that. So they also gave me an injection for, what's the bowel, like overactive bowel, or like an antispasmodic for the bowel. So I was like, that's that's not my problem. Like, I don't have tummy aches or like this is sharp pain. It felt like internal, like something wrong pain, not just like a tummy ache. It was like sharp pain. Something was wrong. So all these things were ruled out. And I was at my primary care, and I mentioned that I'd had endometriosis before. And he asked me, does it feel like endometriosis pain? And I'm like, no. The pain I'd had before with endometriosis was all pelvic, uterine, ovarian, cramping, that kind of thing. This pain was new to me. It felt like higher in my stomach. I was having sharp pains in my sides and just aching and sharp pains all the time. And I couldn't do anything. I sat with a heating pad for months until I got that discoloration, that ugly discoloration, like mottled, disgusting, ugly abdomen from like having the heating pad on 24/7. I slept with it in the bed. When the heating pad timed out at night, it woke me up because of the pain. And I couldn't do anything. I couldn't stand in the kitchen and cook. I would double over, lean on the counter, just like Lamaze breathing, like I'm birthing a child with these sharp pains. It was horrible. And so then I finally thought to myself, well, everything's been ruled out. Like, what can this be? Do I need to get checked for endometriosis again? And then I remembered it had been a couple of months before that. I had woken up in the night with this horrific pain. Tearing, stinging, burning, sharp, stabbing pain on, like, right around the area of my right ovary. And I thought to myself, that was really similar to the pain I had when I was a teenager and I had to go into the emergency. And I thought, I wonder if that was a cyst rupture. And then I thought to myself, what if it was an endometrioma that ruptured? That could be causing all this. So I went to the gynecologist. My amazing, wonderful gynecologist had referred me to this specialist who specializes in complicated cases of endometriosis. She gave me his name on the back of a card, and it was like hush hush because he was not within her medical system. She wanted the best care for me. I appreciate her so much. And I had this guy's name, and I was like, I don't want to go to a male doctor. I just don't. Like, how is he going to understand me? I'd rather have a woman, doing the exam and all. At this point, I was desperate. I was like, let's go see this guy. I just prayed, asked the Lord, like, please let this guy help me, give me some answers, whatever kind of answers. So I went to see him. He listened. He made notes. Every symptom that I described to him, he said, yep. So he's like, okay, let's do an ultrasound. So they did an ultrasound. Everything looked good. So I went back and he reviewed the ultrasound results with me. And he says, we don't find anything. Everything looks fine. And I said, you're kidding. He said, but just because we don't see anything on the ultrasound doesn't mean that there's not something going on in there. And I said, I'm miserable. I can't keep living like this. So he scheduled me for laparoscopy again, the same kind of surgery, only this time he explained to me about how the preferred treatment is excision surgery. And I was like, because, I'd learned this since my first operation. And I was so excited because I'd searched for endometriosis specialists who do excision surgery, and like the closest one was somewhere hundreds of miles from me. And I had no idea this guy was right here, like 2 miles from my house. That is provision from the Lord right there is what that is. And right at the time when I needed it. So like, I just was smiling from the moment we left the doctor's office. Never been, except for the first time I had endometriosis surgery, I've never been so excited to go to the doctor, to go to the hospital, to have surgery. I couldn't wait to get this thing fixed and addressed and feeling so much better. So we did the surgery. He went in there and he ended up having to remove an ovary because the scar tissue was so bad and it was adhered to, I think this time it was adhered to my abdominal wall, the side of my abdomen. And, I'd gone over my history with him and he's like, he discussed with my husband during the operation. He was like, "This is what's going on. It's really bad. If I can try to clean it up as best I can. I can, free it from the abdominal wall and all that and just leave it, but it's going to happen again. It's just in really bad shape." So the doctor felt it best to remove it. My husband agreed because he knew how I felt about it, and I was so glad that he went ahead and removed it. And that's caused me some issues with mood swings right after surgery. It was like maybe a couple weeks after surgery. Oh, my hormones were crazy, and I was so depressed and so not myself, and I hated it, and I thought, I wish I'd never done this. But since then, my body's been adjusting. I've been getting better, and because I went through a stage with that when I was anorexic, I can identify when I'm starting to feel like this overwhelmed feeling. And I can say, okay, I'm going to stop whatever this is I'm doing right now. It's overwhelming me. I'm just going to take a break and walk away and not let it get to like meltdown stage. So I've been able to deal with it. Okay, had some pretty bad setbacks at first, and now I feel like God is just continuing to work healing in my body, and that hasn't been an issue since. I've had a couple of times where I've had that overwhelm, but I've just been able to say, okay, Lord, I don't want to feel like this. You know how I feel. My feelings aren't truth. I'm just trusting you. You're healing me, body and mind, and just step away. And I've been able to deal with it fine. And the Lord has helped me through these things, but healing is still continuing. I've been healing really slow. And I think part of that is, my recovery time for the ablation surgery was like 2 weeks. And I felt pretty good, like uterine, ovarian wise, all of that, the first surgery after 2 weeks. I still had that hernia thing, so it wasn't like 100. But this time, it was a lot longer than 2 weeks. And the surgeon had found that ovary was the issue, so he removed it. And then he had, he told me that he like scraped the inside of my abdominal wall, like on that section where the ovary had been adhered, that he just took that out too, so that hopefully he got every bit of that endometriosis tissue from that area and just got all of that. So I had, pain and recovery from the ovary being removed and then the abdominal wall being scraped. And my bladder was like in the worst shape. I think that was the worst part of it. And I remember when I had that symptom of a horrible UTI a few months earlier, when it all started, it was like this heaviness in my bladder and this burning, and that would just come on randomly. And what do you know? When he gets in there, he finds there's endometriosis scar tissue covering my bladder. So he spent a lot of time just scraping my bladder and pulling out that tissue, cutting it out, pulling it out by the root. And as he was doing that, it tore my bladder. So he tore a hole in my bladder like that big. He's like, it's not very big, it's that big. I'm like, that is huge. Is it not huge for a bladder? Anyway, I just remember hearing that when I was coming out of anesthesia, like before I could even open my eyes, I hear them talking, saying ovary removed. And then I'm like, what? Really? Okay. I don't even want to wake up. When I heard them say that, a hole torn in the bladder, have to wear a catheter, I was like, I'm going back to sleep. I'm not waking up from this right now. No. But I had to wake up. I had to face the reality of it. So I had a catheter in for 10 days, and it was absolutely miserable. Just God bless and be with anyone who has to deal with that. I'm so sorry. After about 10 days, I thankfully was able to get it out. It was just worse because I had a ton of bleeding. Like I had bleeding for 2 weeks afterward, and it caused me, like I had all this bleeding. The nurse was like, oh, okay, you're having some bleeding. And I'm like, did he do anything inside the uterus, inside there? Because I thought it was like all in the surrounding area inside the abdominal cavity. She's like, yes, that's what happened. He didn't do anything in there, but anytime you have like surgery in that area, bleeding down there, like that's where the body flushes it out from. Like, oh, okay. So I had quite a bit of bleeding from that, and then it caused my period to start. So I had this lovely, intense period while I was going through all of this recovery pain and while I had the catheter in, and it was really sore. It was miserable, and I'm really sensitive. My skin is so sensitive that the catheter stabilization devices on my legs, like they just made that adhesive and that catheter tube, like just the weight of that on my leg, pulling my leg where it was attached, it was like raw. It was like hamburger meat. It was horrible. And so I switched it to the other leg, and it was like a couple days it did the same thing. My sweet husband went and found me a catheter stabilization device that you wrap around your leg with Velcro to hold it in place and not have to use adhesive. So that was wonderful. But when I had to take a shower, and I had to take a shower twice a day the whole time I had the catheter in to make sure it was clean and all. So I was like a little old lady, like hunching down the hallway to the bathroom to go and clean up. And it was like every time I had to do that, I had to tape the catheter then. So I started getting raw skin from the tape I was using. It was like my legs were hideous and itching and raw and painful. I was just like, Lord, please, when is this going to be over? But he did deliver me from that. And I'm looking back, like I'm thankful that I was able to have the catheter because it allowed my bladder to heal. And after the 10 days was up, I had to go to get a cystogram, which is where they fill your bladder extremely full with dye to make sure there aren't any leaks. So the technicians that took care of my test were shocked because I was a grown-up and not a baby. They said they don't like get any adults for that test. All they see are babies and toddlers that have urinary problems. And I just thought how horrible for these little babies to have to go through this test, because for me, it was miserable. It was the most painful, miserable experience I've ever had physically. Was that just praise the Lord, it lasted like 1 minute, 2 minutes. They fill your bladder till you feel like it's gonna pop, and I truly believe it was filled to capacity and stretched. So I know that thing was healed. I'm thankful they did the test well, because I did want to make sure the result was accurate so that there was no leaking or anything. I wanted to make sure I was healed up before they took it out, but it was miserable. Like your bladder is a muscle, right? So I hadn't used that muscle in 10 days, and that's a long time. I mean, how many times do you go to the bathroom throughout the day? You're not using that for 10 days, so it's going to be sore. They told me there may be cramping because there may be that reaction from the muscle. Thankfully, that didn't happen, but it was just this feeling I've never felt. I only ever thought I had to go to the bathroom until I had that test. And it was like, I usually am pretty good. Like, I'm not very reactionary. I'm just not. I have pain, I have discomfort or whatever, and I just sit here. I don't scream. I don't yell or like, oh, make it stop. Like, that's just, I don't know. I've always internalized that, like, not to complain or not to whatever. So that's just how I am. My sister's very much the same way. That's how our mom was. I don't know. I guess it runs in the family. So, like, I start feeling this in my bladder. It's getting so full to the point where it's hurting. And I'm asking the guy, okay, how much longer do we have to go here? And he says, until you start squirming around. Like, I'm probably, like, not going to squirm. That's just me. And I'm like, well, I'm starting to feel it. He's like, oh, okay, good. And so I sat there and I tried to bear it, and I was like asking him questions to try to get him to talk to me. And I just, like, everything just faded away. And I said, I don't think I can do this much longer. And I just started breathing, like Lamaze type breathing. I couldn't even replicate it. It was just like involuntary. And I was not like the squirming type. I'm just like, I get very still is what I do. It was like, and I just had tears just coming. And so he was like, okay, it's okay, honey. It's okay. Just breathe. We're going to stop it. We're stopping it. And so I had to have this full bladder. And it's like, I really think it's a sensation that you just don't experience unless you have an issue like that, because, you know, your bladder gets so full, and you can try to hold it, and eventually you're just going to wet yourself, right? But I had this catheter in, so they were pumping this in. My bladder was getting fuller, and there was no outlet. So, I mean, they like clamped the tube. So there's no way that I could have that relief of, like, you know, you would just automatically just pee yourself. It was miserable. And bless anyone out there who has to take that test. The good thing was it only lasted like a minute. I mean, it seemed like much longer. But then with this incredibly full, painful, stretched bladder, you have to like turn your body this way and hold yourself at a 45-degree angle. Like roll your body this way, roll completely on your side, roll back this way so they can take all the images. So the whole catheter experience and that test, that was the worst. But by the end of 10 days, I was learning how to deal with the catheter better, and I was starting to feel better with all of the other stuff that had happened, you know, the bladder healing, the incisions healing, the ovary being removed, the abdominal wall being scraped, all of that, the bladder being scraped and tissue pulled out by the root, like all of that. After 10 days, I was starting to heal from that. And so I was starting to feel a little bit better in that way, which made it much easier to deal with the catheter. And then I was having all the bleeding at the same time and the horrible period cramping. It was just like all these things at once. Kind of, it was really hard to deal with. But now I'm like 6 weeks out, 5 weeks out, I think. So I went to the grocery store for the first time the other day, and I hadn't been to the store really. Like I had gone right before my surgery just to like get the things like gauze or whatever that I thought I would need right after surgery. But other than that, like I hadn't really been on a shopping trip. I hadn't walked around the store because I just couldn't. It was way too painful, and riding in the car was very painful. So I've been able to get out. I've been able to move around. I can move around the house now. I can pick up my dog and take her outside, and my squishy pug, and take care of her now. And it's amazing because I almost don't remember what it felt like before I had the surgery. That horrible pain that I had for like 3 or 4 months, that I couldn't do anything. And it was so depressing, and I couldn't stand in the kitchen to cook. All I could do was like sit in my chair with my heating pad, and I almost don't remember what that felt like now. I'm so thankful because the Lord has brought me this healing in this way. It's just gratefulness is what I feel now. And I'm continuing to heal. I had like the weirdest reaction to the surgical glue because #me, I don't know, but I had that. So it caused a tissue reaction, and it took my incisions a lot longer to heal. And then one of them started to heal open. So I had to go in the doctor, and he had to scrape it out until it was a raw tissue and started bleeding again. And it was not pleasant, you know, but I'm glad because now hopefully it will close up and start to actually heal. So it's been a long recovery, and my endometriosis journey has been a long journey. I just want to share because I want to raise awareness, Endometriosis Awareness Month, that this is a real thing, even though it's invisible. Like you can't tell, and you can't even most of the time. Oftentimes, I'll say oftentimes, it's not even seen on imaging. So there's a lot of doctors who are even skeptical. You have to find that doctor who's willing to do the exploratory surgery and then fix whatever he's able to find. Because like mine, I mean, my bladder was that bad. My ovary was that bad, and none of that showed up on a CAT scan, on an x-ray, on an ultrasound. Thankfully, my doctor was willing to listen to me, took my symptoms seriously, and now I'm going to be able to recover from that. And I'm just trusting the Lord day by day. He's continuing to heal me. He's used this doctor to bring this healing experience for me. And I, experienced all of these recovery things happening at once. The allergy to the glue, the tissue symptoms, the opening up of the wounds, the bleeding, the catheter, like all of that, the little bit of the mood swing going on. Like I experience all of that for a reason, and I trust the Lord's going to use that. So even if it's just through this video that somebody watches and is like, yes, I can relate to that, like I'm telling you, there's hope. So hang in there. And I'm really hoping this is going to be the end of my surgeries because it was Excision. So that tissue has been cut out. It's not just been trimmed, it's been removed. So I'm hopeful that he got all of it, and it's going to continue. Like I still have some pain from that in different areas. And there were other areas that he found tissues in there, endometrial tissue, besides my bladder, besides that ovary and the side of my abdominal wall. Like there were other areas that he had to scrape out, like in the posterior cul-de-sac, and like cut that tissue out. So I have different kinds of pain in different areas, and now that it's like going through this healing process. And since I'm like such a slow person, I'm slow in all things pretty much. So why should healing be any different? But I'm just trying to be patient with myself. I know that it's coming and I'm seeing the light at the end of the tunnel. So it's been a long road, but I'm thankful for the journey because I know the Lord's going to use that. And just wanted to share to encourage anybody else going through this to spread awareness. And that's my story. I hope I'm close to the end of my story, but it'll always be just like thanking the Lord. My story will continue in that I have healing and that I am able to share about that. So wanted to encourage anybody out there who's going through something like this, any kind of invisible illness, like hang in there. It's not in your head. Find a doctor. Keep searching. I mean, it was since I was a teenager until I didn't have my first surgery until I was like 27. So it was like 10 plus years before I even got a diagnosis. So keep searching, keep looking for a doctor who will listen to you, who will take you seriously. And they're hard to find. I saw a lot of other doctors throughout there too. There were several other gynecologists I saw, and they just either didn't care, didn't know, weren't aware. Keep searching and keep praying because the Lord will provide. He provided this doctor for me that there are so few of, Excision specialists, and this doctor was like 5-10 minutes from my house. So the Lord will bless you. Just hang in there, keep trusting, keep praying, keep searching. Okay, if you guys want more content like this, just let me know. Give me a thumbs up. Follow me on Facebook, Pinterest, Instagram at Live by Grace blog. Send me an email, liv@livebygrace.com. And drop a comment, whatever. Just let me know if you like this and if it's been encouraging and what other kinds of stuff you'd like to see and hear from me. So be blessed and have a great day. I'll talk to you later. Bye.